The following segment is sponsored by Optum Utah. Sneezing, itchy eyes, and nonstop sniffles. Allergy season is in full swing, and Dr. Nguyen from Optum Utah is here to break it all down for us. Doctor, welcome back to the show.
Thank you for having me.
This is honestly the worst part about spring, but it's here. How common are allergies and seasonal allergies?
It's extremely common. I would say tens of millions of Americans deal with it every year. It's something that I deal with every single week during this time of the year in the office.
All right, so what causes seasonal allergies?
Multiple different things, but most often is coming from potential genetic predisposition. They can be triggered in the environment that lead to some of the allergic reaction the patient deal with. Yeah.
All right, so what are some of the common symptoms of allergies?
Yeah, common symptoms can be things ranging from nasal congestion, so runny nose, watery eye, itchy skin. Certain people can develop a rash or a hive, so those are the more common symptoms that I see.
Yeah, I get really itchy eyes with mine. How are allergies diagnosed?
Most often it's a clinical diagnosis, so we would see a patient in the office and listening to the story and symptom and diagnose them based on the history. There are certain tests that we could do as well to identify allergic reaction and patient with allergy, but most often it is a clinical diagnosis.
So we've talked a little bit about, what causes it, what we can do. What do we need to know about kids and allergies?
Yes, for kid and allergy, I think a lot of time, it also depends on the severity of the allergy condition that kid deal with, but sometimes it can be quite significant for a kid. And a lot of time, what I counsel patients and parents on is that for kids, it really is important to identify the trigger. You want to know what could lead to an allergic reaction in the kid, because most often, as adult, we are the one that dictate the environment that they're going to be in. So
it's important to do that. And I mean, it's getting warm. Kids want to be outside, so you want to help them be comfortable playing outside. Right. How does pollen affect our health specifically? Yeah,
it can be quite significant in terms of its effect on the health of certain individual. Obviously, pollen is one of the well-known triggering factors for allergy. It can also affect how you breathe, despite the fact that you may or may not have allergy. It can trigger certain reaction on your skin, among other things, and so it is a challenge for people to deal with during this time of the year.
But there is good news because there is help. What prevention or treatments are available? Yeah,
there are quite a few effective medication over the counter that you don't need prescription for. Things such as a nasal spray. There are steroid nasal spray, antihistamine that you can take in a spray form, and an oral pill as well. Those can be quite effective for patients in the mild to moderate category of allergy reaction. And those are something that you can take proactively as well. Prophylaxis, meaning you're trying to get ahead of the reaction itself. So maybe if you know that you're going to be in a situation where there are potential trigger for allergic reaction, you can take these things a few hours to days before to kind of prevent the reaction to come on.
There you go. Prevention is key, so you can actually enjoy spring and not be sneezing, itching, eye itching, skin itching. Where can we go for more information?
Yes, Optum.com/Utah is always a great resource. There are the American Association of Allergy that you can read more about on the topic of allergy as well.
Perfect. Well, doctor, thank you so much for coming in.
Thank you.